Welcome. You know me. Most of you all know me. I'm Melissa Fournier, the Director of Nursing here at Alpena Community College. I was a 97 graduate of the LPN program, 98 graduate of the RN program, a 2000 graduate of Lake Superior State University, a 2003 graduate of Wayne State University, and now am currently in my doctorate. Woohoo! And will graduate in December of 19 with my doctorate in nursing. So that's pretty exciting. And you're going to hear us talk a lot about education and continuing your education and moving forward, and that's what you want to do. So I'm glad to see all of you here. Welcome. You can hit me with questions anytime. I will ask for questions at the end, but as we go through the handbook, I'm going to try to answer everything that could possibly be a question, hit the highlights for you, and make it so that you're ready to go in this program. Everybody got an orientation folder, and we will start off on the left-hand side of the folder. Now, my folder might have gotten messed up because I did this orientation in Oscoda last Wednesday. So the first thing I want to talk to you about is ACEMAP. You probably got an email from Lisa that talks about ACEMAP. ACEMAP is a central registry that contains all of your paperwork. You may not have this if you didn't purchase it from the bookstore yet, but you are going to get a packet from Lisa when you show her that you've purchased ACEMAP, and it's going to be your introduction to ACEMAP. So it was an extra $50 this year. Next time for new students, it'll be wrapped into the clinical cost as a clinical fee. But because this was our first year doing it, we enrolled in ACEMAP in July of this year because I had to wait for my fiscal budget. But what ACEMAP does is it holds your license, it holds your CPR, it holds all of your immunizations, and the $50 fee that you have gives you access to it for a year. Now, all of the clinicals that we do at Mid-Michigan require that we're part of ACEMAP. So we had to do this. It wasn't an option. But what it does is if you guys want to go somewhere else, say we want to do clinicals at Mid-Michigan West Branch, we can do it because we're part of ACEMAP. Or if there's other facilities that maybe we want to take a trip to and go down to, if we're in ACEMAP, they can see a roster right away and permit us to go there. I don't have to have a separate clinical contract for that. So it really does open up a lot of doors for us to be able to go to different places. So it's a good thing. But when you get the email from Lisa, I need you to fill it out. Because without you filling out your ACEMAP, we can't create the rosters for clinical sites. So really, really pertinent for my level 2 students that you get that ACEMAP done quickly. Okay? My level 1 students, you're going to Medalodge first, so you won't have to worry about that yet. But for next semester, get it done now, then it's done. We can build the rosters. Okay, so moving on. I know that in your folder you have a paper about an ice cream social. Let's talk about the fun stuff first. So our welcome back to you guys is going to be an ice cream social this year. For main campus, it's going to be on September 6th on a Thursday. For Oscoda campus, it's going to be Wednesday, September 5th. So this year we are launching an LPN program in Oscoda. That's going to happen. We've got 4 students that are going to meet down there. And so everything that we're doing, we're going to be inclusive of Oscoda campus. So those of you who will be in Fundamentals of Nursing, it's going to be an interactive class with students in Oscoda. And hopefully this goes really well, and then eventually, over time, we'll launch an RN program. But that is happening this year. So come to the ice cream social. We'll give you a chance to meet and greet people. You have a sheet in your folder that talks about lab time. Came from Lisa. The way that you log, book, request lab time is through Lisa. So it's got her contact information on it. Her phone number is on it. So if you're in your lab class and you want to practice IV starts some more, or you want to practice dropping an NG tube for my RN students, or say you need to practice wound care or Foley insertion for my LPN students, the way that you book the lab is you call Lisa. Now, if you want an instructor to be present or a tutor to be present, let Lisa know that too, okay? Tutoring will come through the Tutoring Services Center, but an instructor, she'll book it in an instructor's office hours. And then they'll be there to help you practice, okay? And if no instructor is available, guess who it'll be? Me, which is fine. I will help you do that too. Another sheet that you have in there has Elsevier up at the top of it. The Elsevier student account, you want to create a student account because we use Elsevier textbooks. And some instructors require you to do case studies or look at images that are on Elsevier. You want to get your student account, get it all logged in, set before you start class, so that if there is something that says that it's on the Evolve website, you can easily get to that. Another helpful piece of paper that's in your folder talks about ACC's services at a glance. It's colorful, talks about student life activities and housing, the backside, all the services that are there, the Student Services Center, Technical Career Services, the Testing Center. You want to star that one because you will need that. The library hours, Blackboard support. This is a page that I'd magnet to the refrigerator. It's handy. You want to know where it is. Okay, you have a colored sheet of paper, and it says the Community Services Log. This is what Ms. O'Connor was talking about when we talked about community service hours. And everybody's page is a different color. So you're looking for one that is a colored sheet of paper that says Student Community Service Log. And they're all different colors. It's just easier for us to keep track of them being different colors. So it kind of stands out for us. So what you're required to do is 10 community service hours during your LPN year, 10 community service hours during your RN year. Now, if you do more than that, keep track of that for us. Because when it comes down to the awards, that we'll talk about in a little bit, you may be exactly the same as somebody else, but somebody did 30 community service hours and you did 10. If everything is the same, we're going to pick the person who did 30 community service hours. So it's just something to keep in mind. Now, you can do the Zonta Walk for Women. You can volunteer to feed people at the nursing home. You can volunteer to walk animals at the animal shelter. All of those are different types of community service hours. If you don't know if it's medical or non-medical, ask me. I will let you know. But you have to do 5 medical and 5 non-medical. Okay? Now, if you do it and you get it signed and it's all set, you can turn that sheet into Lisa. It's okay. You do not have to hold this until you have all 10 of your hours done. If you're worried about losing it, turn in what you've got. If you ever need to ask Lisa, how many community service hours have I got, she will let you know. But 10 is the requirement for graduation. All right? Okay. Everybody has the Sna Bylaws in your folder. The Sna is the Student Nurses Association. Everybody who is a nursing student here at ACC is automatically a member of the Student Nurses Association. So these are the bylaws of that organization. You're going to want to read through them before school starts. And usually in the first week of classes, you will be visited by an upperclassman who tells you a little bit more about the Sna, who's going to ask you to volunteer to be an officer. The breakdown of the officer positions are all in the bylaws. You'll see that some have a stipend associated with them. It's not much, but it's something because you are having to put in extra time. They do things with community service organizations, pinning as part of the Sna, fundraising. This semester, we're actually going to have an honorary dinner for Mrs. Jackman, who retired. So that's something that I'm going to ask the Sna to help out with this semester. But read through that before the first week of school. My LPNs, you guys have a blue sheet of paper in your folder. My RN students don't have this piece of paper. So I'm going to talk to just my LPNs right now. This is your contract for medications. This is a contract that you enter into with your clinical instructor to pass medications. So every time you go to administer a medication, we're going to expect that you do these things listed here on this sheet of paper. And then you're going to have your instructor initial when you complete those items. And there's even items on the back side of the sheet. You will hold on to this piece of paper, take it with you to clinicals for the entire year until the Monday before finals week next semester. Then it goes to Lisa, and it gets put in your folder, your file that we keep for education. But you want it to be as complete as possible, signed by your instructors. Okay, so this is something you want to put in your clinical folder that you take with you to clinical every day. All right? So a couple of pamphlets that are in your folder. One talks about the workshops that are offered by the Student Services Center. It's a nice handout on what they're offering, where the offerings are. They are doing them interactive with Oscoda campus also. So just to make you aware of that. Also, if you have an APA paper that you have to do, they'll read it for you, they'll proofread it for you. Always a good thing. Have another set of eyes read your paper. Other pamphlet, we always start with the end in mind. So the end in mind is you passing your boards. Please and thank you. That's what we want you to do. All right? And I am very happy to say that right now we're at 100% pass rate for both sides from my May graduates. So very exciting. Happy to hear that. So this pamphlet just answers some frequently asked questions to tell you about what you can expect for your boards. The last sheet is for those student services. This is an application that I'd like you to fill out and turn into Lisa so that if you need any student services during the semester, we can get them for you. And you don't have to be in crisis to get them. Sometimes we have students who need gas money. They need tutoring, they need assistance, they need to talk to a counselor. If you fill this out, we can get you those assistances right away. Whereas if you come to my office in crisis and I hand you a form to fill out, yeah, it's not opportune timing. So opportune timing is for you to do it this weekend and give it to Lisa on Monday. Okay? Fill this out, please. The other thing that you need to give to Lisa, you have, now I should be moving to the other side of the folder. You have a packet of papers with a half a color sheet on it. These are all of the items that you need to fill out and turn into Lisa. So it starts off with the Handbook Declaration. After we go through the handbook, I'm not going to read it to you. I'm going to hit the high points, and then you're going to read it this weekend. If you have any questions, ask me. Shoot me an email, stop by my office. But then I need you to sign this Statement of Understanding. I don't plan to make any changes to the handbook. If I do, you'll be emailed, and you'll have to sign another sheet saying that I made changes. But I don't anticipate making changes. The next page is several consents. This one is permission for picture ID. For you to go into Mid-Michigan, you have to do picture IDs. And this is only in the LPN packet, obviously, because I have notes from Lisa. Then we have video release form. There are times when photographs may be taken, videos may be taken, and we need your release for that. This one is Instructor Recommendations. Oftentimes when you graduate and you go to get a job, they're going to want to see your clinical evaluations because that's the closest reference we have to what your skills are. So your employer is going to ask. Now, you may want to give that to them, or you may want to have us. This would be if you want us to release them to them. If you don't want to do that, you can always get a copy of your evaluations and give them to them personally. Okay? Next page. Student clinical evaluation release. The other one was instructor recommendation. Student permission for employer feedback. This is a very important one because once you go out and get a job, because we are ACEN accredited now, meaning we have national accreditation, we have to get feedback from you guys post-graduation, 6 to 12 months, and wherever you may be working, we want to ask them how you are as an employee or how an ACC graduate is. And we've always gotten exceptional feedback. Typically they say, send us more. We want your people. And that's what we want to continue to hear, but we can only, with your permission, ask your employers that. And I think that's it. So that entire packet needs to go to Lisa on Monday. All right, next is the handbook. Any questions with any of that stuff so far? Okay. All right, so the handbook begins with the table of contents and then a welcome letter from me that you can all read at your leisure. It talks about the fact that we're ACN accredited, and to maintain that accreditation, we have to fill out surveys. So we're gonna ask you to do course surveys, we're gonna ask you to do end of program surveys, but that's to help because your feedback is important to us. We wanna know what you think, and if changes need to be made, then we'll make them. But surveys are gonna be critical to that. Then on to page 4, the mission of the nursing program, in a nutshell, is to create safe and competent nurses. If we don't think that you're functioning safely, you're gonna be warned by your instructor. And that's how you're gonna be evaluated clinically, that's how you're gonna get feedback from us, it's usually gonna be a safety issue if we have a problem. So, and that comes right straight out of the mission. We wanna do student-centered, evidence-based education experiences. We want you to grow and be lifelong learners to produce safe and competent nurses. So our philosophy is very eclectic. We have 10 beliefs that are all there on page 4. You can read through that. This is what is the fundamental foundation of our program. This is what we strive to do on a daily basis. Now when you turn to page 5 is for my LPN students. If my RN students want to turn to page 6, these are the student learning objectives that the program is designed around. So for this first semester, for my level 1 students on page 5, you're going to be trying to achieve that first column of objectives. So when you get your clinical evaluation, that's what the standard is that they're going to hold you to. That in clinical, you did these things that are in that first column between now and December. Every clinical requires you to do a self-evaluation. So already, for your Metal Lodge clinical rotation, these are the objectives you're going to be graded against. And so you're going to want to be able to, in your self-evaluation, speak to these objectives and your performance of them. So your instructor may not see everything that you do, but maybe you had a really good interaction with a resident and you demonstrated professional behaviors. Maybe you didn't share confidential information with the roommate and you redirected them to something else. Well, you want to make a statement about that that's how you demonstrated professional behaviors because you didn't breach confidentiality with the person's roommate. Now, your instructor was 7 doors down doing a wound dressing, so they certainly didn't see it, but you can speak to it in your self-evaluation. And same with my RN students. As you look in that first column on page 6, I'm looking at you to achieve those objectives by December. And so when you do your self-evaluation, you're holding yourself to that higher standard. These objectives are leveled. So you'll notice that on page 5 and on page 6, I speak to professional behaviors, communication, caring interventions, clinical decision-making, collaboration, and teaching and learning. Because there are 4 different levels of that for this program. LPN has the first 2 levels, RN program has 3 and 4. And we talk about professional behaviors leveled 4 times. We talk about collaboration leveled 4 times. So they may seem redundant, but actually they're consistent. And we're talking about how we build nurses. So those are 2 very important pages. You're going to want to mark that page for when you have to do your self-evaluations. And you'll have to do self-evaluations for every clinical rotation that you have. Page 7. Yeah, I get to brag a little bit. So our Nclex pass rates, as I already said, we're at 100% RN, we're at 100% LPN. And you'll notice that we gauge ourselves by the national standard. For this year, the national standard for the LPN is 84.24, for the RN is 83.84. So with us at 100%, we're doing great, and we want to continue to do that. Our program completion is around 95%. Graduate satisfaction is the high 90s. Employer satisfaction is 100%, and our job placement rates are 100%. So we are an equal opportunity employer, and the competencies that are at the bottom of page 7, you will see on every syllabus. You saw it on your dosage calc syllabus. You'll see it on every syllabus from here out. It talks about how nursing particularly meets the college's core competencies. And so that's all spelled out for you, and it'll be spelled out on every single syllabus that you see. So admission criteria, we can jump through that because if you're sitting here listening to me, you met it. I will hit the admission criteria for RN. That is on page, ADN curriculum is on page 10. And basically, if you are in my LPN program, you need a 3.0 GPA, and you get into my RN program. That's what you need. So I take into consideration your prerequisites and your LPN curriculum. And so as long as that's greater than a 3.0, you're in for RN. So my RN students, if you haven't already done political science or English 112, let me know so that I can get you in one of those. And if you need it for next semester, let me know to get you the other one if you didn't get them. All right. So the curriculum is on page 14 and 15. You can look through that. That's what you're going to achieve in this year. And then we get down to the meat and potatoes on page 16. So if for some reason you have a misadventure in a course and you have to repeat a course, you are allowed to repeat one course in the program, and you will have to go through a student success committee to be granted that achievement. Because if you are unsuccessful in a course, we want to make sure that you have the mechanisms in place to be successful in that course. If you fail 2 or more courses, you're out of the program. That's what that section discusses. We encourage you not to work. I know that many of you do work, but we encourage you not to work because of the demands of the program. And if you do fail a class, we're going to ask you heavy questions about that. Because if it's taking your time, energy, and effort away from school, we want you to have the end goal in mind. If this is what you want, reprioritize. And I know that's hard to do. Standard precautions are what's followed in the nursing program. So if it's wet and not yours, don't touch it without gloves. Ever. And if you do have an exposure, the expectation is that you let your clinical instructor know right away that you've had an exposure. You may have the opportunity to wash first. Please do that. If it was a puncture, please express blood from it, wash for a good 4 to 5 minutes, and then find your instructor, because that's going to help you more than anything else. So proper hand hygiene. If you do have an exposure, maybe it was a splash in your eye, go to an eye wash station, eye wash for 4 minutes, and then let your instructor know. And we follow the policies and procedures of the facilities that we work in. But instructor is a key component to that. So I talked about the awards that are offered. They're listed there on page 117. Some of the awards come with a stipend, some don't. Some are just bragging rights for like highest clinical and theory awards. But then when you get into some of the scholarships, those have monetary checks with them. And again, if everything is the same, it may come down to those volunteer hours where we make the deciding difference. Confidentiality, huge sticking point for me. You cannot breach confidentiality in this program. We are entrusted with sensitive information for our patients. You may even hear something for a classmate. That's private. It doesn't leave here. You will notice in the minimum disciplinary action of this table, even the first level breach, which is just careless, oops, you said something you shouldn't have in a public area, you'll notice that the last bullet point in that column is dismissal from the program. I can make the choice whether or not to remove you from the program based on that careless breach. Because right now, you're getting your first warning. Don't breach confidentiality. So everybody's hearing me say this. Next page shows you a level 2 breach. This is curiosity or concern. You'll notice that both of the last 2 bullet points in that column are dismissal from the program. I have dismissed people. I will in the future if you breach confidentiality. There are no ifs, ands, or buts about this. My clinical partners expect me to uphold this standard, and I do. So the very last one, which is breach for personal gain or malice, the only thing in that column is dismissal from the program. So you need to police each other. You are going to be the person with the other person in the library, in the cafeteria, at the clinical site, going to lunch. And they may be about to breach. Oh, I got to tell you what happened here. No, you don't, because we're not in a confidential place. If you want to go over to the college, I'm sure you can talk to Miss Fournier, because she will listen. And I will make a confidential space for you to share information with me. I promise. If you say that you need to speak to me confidentially, I will make that happen for you. If you are concerned that somebody is going to breach confidentiality in the library, you say, let's go see Miss Fournier. She'll make us a confidential space and we can talk about this. But you guys need to police each other, because if I get a call from the library saying that students are talking about confidential information, and there's 4 of you sitting at the table, am I going to know who started the breach? Probably not. And whose heads are going to roll for it? All 4. Don't let it happen to you. Just don't. I used to run a bakery. I had a student come in on a Saturday morning, walk up to me at the counter and say, I need to speak to you confidentially. I went, okay. So I moved everybody from the back of the bakery all up to the front of the house. I closed all of the intervening doors. I turned on all of the vent fans, and I took them into the storage room so that they could talk to me confidentially. Because that's my job. So you don't have to make a confidential space for somebody to talk to you. You have to bring them to me. Okay? Cover yourself and them. So I will get off my soapbox about confidentiality. I think you get it. All right, so I expect you to conduct yourself responsibly, seek the appropriate instructor for help. Each student needs to act in a manner that represents the college, because you wear the college crest on your uniform. So you're acting as an extension of the college in clinical environments. You can eat and drink in class, not in lab. There's no food or drink allowed in the lab. There is a table set up by where you sign into the lab that you could put water bottles, coffee cups, whatever, but it doesn't cross into the main part of the lab. In the classroom, we ask that you police yourself, make sure that you clean up after yourself so that we're not making a mess for our janitorial staff. Cell phones and personal calls can only happen on breaks. In the classroom, you may be able to use your cell phone as a research device, but in every instructor's syllabus, they're going to spell out their cell phone policy. So first offense, maybe a loss of participation points, and it's a gradually increasing offense. Now, I'm somebody that vibration is noise to me, so if your instructor says put your phone on silent, that means no noise, okay? And especially in the testing center with testing, no cell phones. Another pet peeve of mine is gum in clinical. Some people have seen me react to gum in clinical. I'm just telling you, don't do it. Mints, I'm okay with. Mints you chew and are gone. Gum falls on sterile fields. So no gum in clinical, no gum in my labs. Okay? You're required to be in your assigned area at the start of your clinical. OB clinicals start usually 45 minutes before the hour. Other clinicals start on time, so 7 a.m. for med-surg day shift clinicals. If a clinical conference is held before on afternoon shift, usually that's 2 o'clock. So your responsibilities. You're responsible for your actions. If you have to miss time, you need to get your information from your clinical instructor. If you have to miss time, you need to communicate with your clinical instructor that you're going to be missing time. You contract with the instructor for that blue sheet for my level 1 students for meds. That's what is talked about at the bottom of page 19. And then the Monday of finals week is when she wants that turned in. You're responsible for transportation, health insurance. Clinical sites will give you a place for coats and lunches, but I wouldn't bring anything of value. If you do take textbooks to the clinical site, make sure that you've written your name on the book so that it doesn't walk away. Surveys are talked about again there. I've hit that already. And you're responsible for information that's presented during class. Now, appearance. This is often where there's a lot of questions about. So my dress code for my nursing students, my LPNs, you're going to wear maroon top, maroon pants, scrub top, scrub pants, reasonable fit, not too tight, not too loose. You're going to put the crest of ACC that you can get in the bookstore, the patch, sewn on the left sleeve. Okay, and I encourage you to sew it on so that it doesn't crinkle, the edges don't bend up. My RN students are going to be in white tops and burgundy pants with the crest on the left. I would encourage you guys to use Velcro so that you can bleach your tops. So I would do a full circle of Velcro under the patch, because if you just try to get away with one of those squares, it's going to turn your patch. So I would just use a big full circle of Velcro and put that on the back of your patch so you can bleach it. So undergarments should be skin tone. Crest is an inch down on the left sleeve. You got to wear a badge. Mid-Michigan is now required that all badges for students have to be pink. So don't be surprised about that. So if you have any old badges, turn them into Lisa. But the pink badge is because in the OB department, parents are now being told, do not let anyone touch your baby that does not have a pink badge. So instead of them having to issue us 2 badges, because we work med-surg and OB, they're just going to issue us all a pink badge. Makes sense, but that's where that's coming from. So clean white clinical shoes, no sandals like I'm wearing right now. Same with in the lab. When you go to a lab class, specifically, you guys are going to be in 140 LC, you need to wear scrubs. You need to wear the uniform scrubs that I'm talking about, maroon top, maroon bottom. Now, if you call Lisa and say that you want to come into the lab and practice on Friday, I want you to wear scrubs, but I don't care what color they are. Okay, so extra practice, you can wear whatever color scrubs you want to, but when you come to a lab class, then I want you in lab clothes. So when you guys have 241 is a clinical class, but it may meet in the lab sometime, so you'll be in scrubs. All right, if you choose to wear a sweater, go ahead, it should be white. And you'll wear appropriate attire for specialty units. OB is a specialty unit. You'll change into scrubs when you get there, and you'll scrub into the unit. So they wear blue scrubs. If you're gonna go down to the ER wears blue scrubs. So on a morning when you have an OB clinical, you can come in street clothes because you're going to change into their scrubs. If you know you're going to ER, you can come in street clothes, go to the locker room and change. Okay? All right. If you decide that you need to run in and get a gallon of milk after clinical, I ask that you cover my uniform up. If you decide that you're going to go to a drinking establishment, I suggest that you change out of my uniform altogether. Because before you sit down, I will get a phone call. And then you'll be seeing me in the drinking establishment. And that won't be good. So let's not do that. We're not going to go have a drink. Let's change out of the uniform so that nobody knows you're affiliated with ACC if you're going to have a drink. All right, personal hygiene as expected. Hair needs to be pulled back and controlled. Mustaches and beards need to be well trimmed, no more than 1 inch in length. Perfumes and aftershave should be avoided. Makeup should be applied in moderation. Jewelry, a plain band. Watch with second hand. No other visible piercings. You can wear 2 pairs of stud earrings in the ears. Fingernails clean and trimmed and not to exceed the length of the fingertips. No visible tattoos. No obvious odors of tobacco. Normal street attire is appropriate for the classroom. If you're going to an observation area, for my level 2s, that's going to be psych. When you go to psych, you don't always wear scrubs. So that would be casual dress, slacks, skirt, but it should be below the knee length. No jeans with rips in them, no jeans. Slacks if you're going to wear them. Tops should be covering, like pullover, appropriate dress. So if you have to be absent, 5% off of your grade for clinical if you're going to miss time. If you miss 20% or more of the clinical, you fail the clinical. So try not to miss. If there is an exception to this rule, it has to be substantiated. You have to have a physician's note or a reasonable excuse that we can substantiate, and then we deal with those cases on an individual basis. If we decide that we're going to send you to a workshop in lieu of clinical, the workshop will be usually at the hospital, and they usually give us some break for sending students to the workshop. So if we decide as a faculty that it's a good enough workshop to go to, we will let you know that instead of clinical that day, you won't need to wear your scrubs. We'll have you come in an appropriate dress clothes, and we'll attend the workshop. And it'll count as a clinical day. So if for some reason you were sick that day, you still have to jump through the same hoops, let your instructor know, so that they didn't give you a no-call, no-show. All right, so if you're tardy to clinical, your instructor can take up to 4% off of your clinical grade. If you're later than 30 minutes to clinical, they can decide whether or not the day is salvageable. If you have to be absent from clinical, you need to notify the unit, and the unit phone numbers are on the top of the next page. You also need to notify your instructor. Your instructor will give you their best contact information, be that cell phone, email, whatever, but you need to let them know too. If for some reason you can't get in contact with your clinical instructor, make sure that you let Lisa know. And I've had students call from the ditch. I was on my way to school, I am now in a ditch. I will be there as soon as I can. And so we'll get news to your clinical instructor. If there's inclement weather, if anyone saw April of last year, there was some serious inclement weather that affected us tremendously. You're allowed to stay at home until the start of your clinical day. So if your clinical day started at tender care at 6 in the morning, you can wait until 6 in the morning to see if they're going to close school. If not, you then have to make that decision. Are roads passable for me or not? If you make the decision not to go, you need to let your clinical instructor know. If you make the decision to go, you need to let your clinical instructor know. So that's our way to keep track of you. So yes, they left their house. It's 3 hours later. I have not seen them. We may need to send someone to help them. So we try to keep track of that. But I've had times where clinical instructors have had to make a call, had to make a decision, and I will support them in that too. And you have to make the decision. If your road is impassable, make that decision. Be careful for yourselves, because we know that you go a mile and it could be a totally different weather condition up here. Makeup assignments can't be assumed. If you miss a test, there will be a 10% penalty on the test, and you need to communicate with your instructor to make that up within a week. If you go past a week, it'll be a 0. If you arrive late for a test, you may not be allowed to enter. And if you receive documentation about jury duty, please get that to us right away so that we can write a letter on your behalf saying that you're a full-time nursing student and now is not really the best time for you to go do jury duty. But let us know sooner rather than later. Next section talks about community service, grading. Grading of theory classes is based on the objectives in the syllabi. Clinical courses are based on those objectives that were on page 5 and 6. The faculty require that you achieve a 75% on the hard points of the course, meaning tests, exams, quizzes, before soft points will count. Soft points are projects, papers, things that you have more control over. So you need to achieve at least a 75% on the hard points of the course before any soft points will count toward your grade. No extra credit is given in nursing, and the minimum cutoff for us for a C is 75%. So there's the grading scale there for you. You must successfully complete the clinical coursework of semester 1 before you can move on to semester 2. And if you're in the appeal process has to be followed through before you can move on. Graduation requirements, we require that you pass everything with a C and that you complete those 10 community service hours. Student services, they were on that sheet that we talked about that I suggested you put on your refrigerator. We offer free tutoring. Let us know what you need. Extra lab time, whatever we can do to help you be successful. So now on to the complaint procedure. If you have an issue with something that's gone on in the program, in a class, what have you, the first thing you do is you talk to the faculty member that you have a problem with. Direct communication. The next step is you come to me. So you make an appointment with Lisa, you say that you want to talk to the director of nursing. She will sign you up with an appointment for me. And my very first question to you will be what? Did you talk to the faculty member? Because if you tell me no, what am I going to do? I'm going to turn you around and send you to go talk to them. Because we want to solve things at the lowest possible level. The lowest possible level is the person that you have the issue with. So they may not realize that they did something that offended you or said something inappropriate. So talk to them first. If you guys solve it, great. If that didn't solve it, if there was still an issue, then you need to come see me. Then I'm going to listen to your side of it. I'm going to talk to the faculty member, and the three of us are going to sit down. And typically, 95% of things we solve at that level. It gets solved, it's handled, we're good to go. If we don't solve it, then we involve Diane. Ms. O'Connor will come in, then the four of us will have a sit down. We'll try to solve it. If we can't solve it, then we go to my boss, which is the vice president of instruction. At that level, the five of us will sit down, we will talk about it, and a decision will be made. That is where the buck completely stops, is with my boss. So that's the order of events if you have an issue. Now that we've talked about that, what if we have an issue with you? So the first situation that's going to happen for you is you're going to get a verbal warning. Now, we write our verbal warnings down so that there's a paper trail. But there's 2 boxes on, it's a yellow sheet of paper that you will see, and it says verbal warning and written warning. The first time you see one, you're going to see that the verbal warning box is checked. That's your verbal warning. So I've already given you all a verbal warning related to confidentiality. Don't breach it. Do not breach confidentiality. So now if you breach it, we're at least at a written and potentially dismissal. But the next step, if you continue to make that same error that you received a verbal written warning on, you will then move to a written warning. The other box will be checked. The remediation will be written out of what you need to do and how you need to do it. And at this stage, you're going to be required to come meet with me. And I'm going to ask what we need to do to help you achieve this so that you don't, and it will give you a whole bunch of options of things that could be a written warning. We're going to figure out what we can do to help you to not make the same mistake. We follow the cheating and plagiarism policy of the college, and cheating and plagiarism also could be grounds for dismissal. Now, we may bypass the verbal warning stage in the event that you do something that is so egregious and we know that it is a violation of principles. Let me give you an example. So we see a student who's getting ready to pass meds. They pop out the pills. They drop a pill on the floor. They go up to the pill without gloves on, pick the pill up, put it in the med cup with the other meds that they're going to give, and go to the patient and tell the patient to take the meds. Okay, yes, I'm seeing an appropriately shocked look on people's faces. Agreed that I would be shocked to see this? And do you think that I would let that patient take that cup of meds? No, because that whole cup is now contaminated, right? Not to mention the student who picked something up off the floor is contaminated too. That's beyond a verbal warning. You all know this, and you're even level 1 students right now. You know that that was a violation of things that you learned in physiology, in microbiology, in chemistry. We know that the floor is the most contaminated spot. that student would at least be at a written for me, because that was egregious. The number of safety errors that occurred in that situation makes that person a threat to patients. Agreed? So probably that person's going to go on probation with me right off the bat. We're going to skip the verbal, we're going to skip the written, and that person's going to have to come see me, and they're going to go on probation. So I would suggest that you not do any of that. That's a big no-no for me. Okay? And usually my examples have happened. So don't let it be you. All right? So if you're sent to me and I make the decision that I'm going to put you on probation, you'll get a letter from my office stating that you're on probation. You will also be told what terms you need to follow in probation, what you need to do. So for this person, don't pick things off the floor, use proper hand hygiene, don't contaminate meds, don't pick meds up without gloves, don't give your patient something that's contaminated. All of those things would be in there, and maybe a few others. Remediation to make them go back to ATI, watch some medication modules, maybe come back to the lab and do some med administration in front of an instructor. A few things would be in there. If they comply with their rules of probation, they'll get a letter from me stating that their probation has been lifted. If they fail to comply with the probation, ultimately they would be dismissed. So we put time frames on everything, so they would know that they would have, a few weeks to complete. If they choose not to complete their remediation, they could be dismissed from the program. But lots of warning shots come before that, okay? So that is probation. If I lift the probation, I will send you a letter also saying that the probation has been removed, which means that your verbal and written warnings are reinstated. So that would mean that you start with a clean slate again, and you have a written and a verbal warning. Okay? All right. That's the handbook.